New at 4 in today's Community Focus. According to CDC data, more than 80% of pregnancy-related deaths are preventable. So what's being done? Here to talk about maternal health is Dr. Emily Miller with Women and Infants Hospital in Keene, New England. Thanks so much for joining us.
Thanks for having me, Kim.
So I was reading earlier that the U.S. has the highest rate of maternal deaths of any high-income nation. Why is that?
Yeah, it's a great question. It's high, it's been on the rise, and it far surpasses that of other high-income countries. And when we dive into the causes, what are the etiologies or the reasons that women are dying during pregnancy or postpartum, the leading contributor is mental health conditions.
And so this is why, in part, we wanted to have you on. Last week was Maternal Health Awareness Day. So let's talk about what is being done to help moms. There's a program called Compass Plus. What is that?
Yeah, so Compass Plus stands for two things. The top, Compass, stands for Collaborative Care Model for Perinatal Wellness Support Services, and the Plus stands for Population Level Equity-Centered Solutions. And the idea here is that we're going to take a model that's been around for 30 years. It's not a new concept, the collaborative care model, but we've been listening to community over the past year to figure out how can we tweak that model to better implement it to meet the needs of birthing people across Rhode Island. And we're really excited that next week we get to launch on our first clinical site.
Yeah, so how can people access these services, and where is that first clinical site?
Yeah, we're starting with the Providence Community Health Center, and they've been incredible partners, so we're so excited to start working there. And every 6 months, we'll be joining another obstetric practice to be able to implement these services. And while we have 6 practices already signed up, we are so eager to partner with any practice that is interested. We've got a ton of educational information, training, all types of resources to help practices go from wherever they are now to integrating the Compass Plus model.
Yeah, I had my daughter close to 3 years ago now, which is kind of hard to believe. And I remember vividly those early weeks and months after giving birth. And at the time, I was given a form to fill out about my mental health. And, you know, I'll be honest, doctor, it felt a little passive. So how are healthcare providers being a little bit more proactive when it comes to meeting women's mental health needs in those early days postpartum?
Yeah, I think it's important to remember that postpartum is absolutely a huge time point, but so is during pregnancy. In fact, the majority of people with a mental health condition, when we understand when those symptoms began, it actually often begins before pregnancy. We just haven't known that it's existed, or it develops during pregnancy itself. And so it's so important that we screen at the first prenatal visit, again in the 3rd trimester, and again postpartum to make sure that we are understanding when these symptoms are happening and we're able to intervene quickly. And it's not just screening, it's screening with that context of why are we asking these questions and what are we planning to do with that information?
Yeah, and doctor, if someone is watching this right now who is either pregnant or has just had a baby, or even a dad out there who might be struggling, what's your advice to them if they need some help?
I think it's so important to note you're not alone. This is an incredibly common complication of pregnancy. About 1 in every 5 pregnant or postpartum people will have a mental health symptom. And so reach out. There's a lot of resources, either with your obstetrician, family medicine clinician, midwife. There's a HRSA National Maternal Mental Health Hotline that's available 24/7 in multiple languages. Just please reach out because there's a lot of treatment options available.
Yeah, there's always help available. All right, Dr. Emily Miller with Women and Infants, thanks so much for being here.
Thank you.